Well, happy Aloha Friday. It is December 4th. This is Spotlight Hawaii. I'm Ryan Kalesuji, joined by Yanji Denise. So great to see so many of you. And we've made it through yet another week here living in this time of COVID-19. And of course, we have used this show as a conversation and a platform to highlight the newsmakers, policymakers, and really to bring the community information about what's happening here in the state, specifically around COVID-19 and of course other issues. And today, Yanji, we have a guest who we have not had the pleasure of speaking with thus far through this whole pandemic.
Yeah, we have been wanting to talk to her for some time. She, of course, is the head of the Department of Health for Hawaii, and that is Dr. Libby Char. She took over for Dr. Bruce Anderson when he stepped down sort of midway through the pandemic, and we are so happy to have her with us here today. She is guiding the state's health policy when it comes to the coronavirus. We have a lot of questions. We know you do too, so put them in the comments. Thank you so much for being with us this morning, Dr. Char. Let's start with the basics. What everyone wants to know: where is the virus right now in our community? What is the most risky activity?
Good morning, and thank you for having me on, giving me an opportunity to speak. So it's different in the different counties. The virus right now we know is pretty endemic and widespread in the community for Oahu and to some extent for the Big Island. Less so for Kauai and for Maui. And what we're trying to do is prevent it from gaining a foothold and being widespread amongst the communities there to the extent that we can. The riskiest activities that we've seen from our contact tracing and where we know the clusters to be continues to be gatherings. And that's gatherings of, the larger the group and people not wearing their masks, the higher the risk. And that's been borne out over and over, even in situations like at workplaces when people gather for lunch and they have their masks off to have, share lunch together. We've seen clusters from that. So anytime that people are gathering, and especially when they're not wearing their masks, outdoors is better than indoors. Being farther apart is better than being near. Less people is better than more people.
Doctor, you kind of taken over this position sort of midway through the pandemic. We know that, of course, Dr. Bruce Anderson was leading the Department of Health prior to you arriving. What are some of the things that you have had to adjust, and what are some of the things that you have implemented during your time as you've sort of taken over this department?
Still getting used to it. It's a pretty large department, and I think one of the pleasant surprises was, and it shouldn't be a surprise, but there are so many really truly experts in this department, public health experts, subject matter experts, epidemiologists, educators, communicators. And I think early on, some of their really good work was being overshadowed by all the things going on in the community and the negativity. So just really trying to encourage them, highlight them, and create a space where they can really do their work in an effective way. And I think that's happening. I think we're starting to see the results of that. Just a lot of good work being done here.
We've had the Safe Travels program for about 6 weeks now. It started in or actually a little bit longer. We started in mid-October. Have we been able to gauge the impact of the visitors? We have the county mayors and now Kauai opting out of that program. Some of the county mayors asking for a secondary test a few days post-arrival. What kind of an impact do you think that having travelers back, even with that 3-day testing, prior to arrival, what kind of an impact has that made on our coronavirus count?
So the travel program is interesting, and some of it's a little challenging only because the way data is collected, it has a little bit of a challenge in terms of if people get a test in their home state on the mainland, we don't necessarily get the results here. Sometimes if they're positive, the results go to the home state, and the home state, if they can figure out that the person's traveling here, they'll notify the Department of Health. But you can see where that can be a little bit of a challenge. And also, if somebody has a positive result and they don't upload it to the Safe Travel, that's also difficult to capture those people. We do find out, and there are a number of ways that happens, but it can be challenging. As far as the overall travel program, there's so many things to balance. And so our perspective is the public health perspective. And there are so many other issues like the business sector and the economy and whatnot. So it gets really complicated. I don't feel like I'm qualified to speak to all of that sector, but from a public health standpoint, so far we're doing okay. we have seen an increase in travel-related cases, obviously, and there is some concern that that's accelerating a little bit as disease across the mainland, is so widespread now. If you go to the Department of Health website, you can see an epi curve showing all the cases. And if you notice at the bottom bar, that's where we list the travelers and travel-related cases. And so you can see a little bit of a bump there. That's expected because we have more travelers coming in. So far, we're doing okay in terms of the hospital community, hospital healthcare workers, and the rest of the Department of Health being able to keep up and contact trace and keep an eye on the travelers.
That's one area that we kind of wanted to also talk about is contact tracing. And we know that that has been an area that the department has had to really build up over this time and over this year during the pandemic. And, Dr. Robertson actually stepping into that role. What can you tell us about the status of contact tracing right now? Are you comfortable with the numbers that you have of the amount of tracers? And are you ready for any sort of potential surge? If you can give us sort of a glimpse into how that program is going.
Yeah, thank you. That's a really important question. So with regard to contact tracing, it is one of the key pieces in testing contact tracing and isolation. We're in a good place right now. And through our experience knowing more about the disease and knowing more about our metrics, we have been able to develop more efficiencies in the way we do contact tracing. I think early on, I'm told that it was one epidemiologist or one epi investigator assigned to each case. And the program has shifted under Dr. Sarah Campbell and also Dr. Robertson, so that it's now being traced. We have priority groups, and it's created a much more efficient system. And what that entails is to identify certain high priority groups where there's a potential for really significant rapid spread in large clusters. And so to place more weight on doing full investigations on those people that are identified as being part of a priority group. For other people that are not in a priority group, we call them, we contact them. We're trying to get the primary care physicians and the primary care health providers to be more active and take a more active role in helping to advise those individuals. So for example, if you had the flu, your doctor would tell you what to do. If you had, something like chickenpox, they would help you to say, this is what you should do. This is what you can expect. These are the actions we want you to take. And we're trying to shift that a little bit more for COVID as well, now that we know so much more about the disease, and save the investigators for those really high priority areas. So we are trying to contact every person, every case, and at least give them that information on what they should do, what to expect, where to go if they need help, and link them back with their primary care provider. What this has allowed us to do is to really expand our capability and to be more effective and efficient in the way we contact trace. And so we have a number of team members now. We're scaling back a little bit, and I know it gets misinterpreted, but what that means is that there are a lot of people from within the Department of Health that were assigned to contact tracing when the numbers were quite high, and they're an integral part of the team. Now that we're meeting the need, we can scale back a little bit and shift those people back to their primary duties within the Department of Health. And so you may see a diminution in the numbers of the listing for how many people are in the contact tracing teams right now, but it doesn't mean we're losing our efficiency or our ability to contact trace. And that way, if we need more people, we can easily pull them back over and deal with any kind of surge and get that up and going again. We also had a number of contracts that we were using from the university and whatnot. And so it kind of doesn't make sense right now to renew all of those contracts. And there were some contract issues like the length of time that you can keep someone on contract. So for now, we don't need to have all of those people on board. But certainly if we start seeing our numbers ramp up, we will pull our internal contact tracers back over. We'll supplement it with others, and we should be up and running again to whatever numbers we need to have. It's just a more efficient system and a more effective use of people.
You know, we like to bring in the audience, and Ingrid Peterson has a question on contact tracing, just about the efficacy and the challenges there. She says, aren't the contact tracers having trouble reaching out about half of the contacts due to people being unwilling or unable to identify contacts or the wrong phone numbers being given? What are some of the challenges there for the contact tracers that you're still seeing, and how can the public help this?
So a little less than half, I think it's maybe about roughly half of the people. Sometimes we don't have a phone number or any contact information for them. Sometimes we have wrong phone numbers or no phone numbers. And sometimes we call and they either won't call back or, don't want to talk to us. And that's a challenge. And that's something that we've also realized that, just having more people to make those phone calls doesn't necessarily change that. So where we could really use a lot of help is that when you go and get your lab test done, make sure that they have proper contact information for you. And then if you know of people who are positive, make sure that, to tell them and to warn each other that, hey, you may get a call and it's okay to talk to these people. We need to get that information in order to ascertain whether or not you fall into a priority group, and to try and help you as an individual say, what should your next steps be? What do we need to do to help you? But that's a big challenge, just trying to get in touch with some of the people.
I want to also bring in a question here from Anne-Marie Maderos, who's asking, how is mask usage being evaluated? We've heard from other officials, we've heard from the Lieutenant Governor, who stated some statistics in terms of the percentage of people that are wearing masks in Hawaii being fairly high. How is that data calculated, and how are you folks calculating these sorts of numbers to provide the mask usage where in Hawaii?
So the Department of Health, we coordinate with some volunteers, and they go out into the public areas where we expect people to be wearing masks, like shopping malls and whatnot, where you expect that people should have their masks on. And I believe it's done on a weekly basis, and they will sit there and just kind of take a tally of who's wearing masks and who's not. They get thousands and thousands of people every week to make it a reasonable statistically sound number, and then they record that every month and they track it over time. And so I know there are some graphs on our website as well for that. I'm told that overall our mask use in the state is trending up, so I'm very grateful for that. We've been trying really hard to message that is such a key component in keeping us safe.
Another question here from Chad Rogers. He often asks about schools, and he just says, talk about the kids and schools. I think a lot of parents, it's been a really challenging year with so much distance learning. There are some kids who are able to go back, especially those with special needs or who have to be in the classroom, but that's definitely not the case for the majority of parents. What is your outlook for 2021 when it does come to in-person learning? And we know that, of course, the superintendent will make the calls on that, and various area superintendents as well. But from a public health standpoint, what is your view on sending kids back to school?
Yeah, Dr. Sarah Campbell's been doing a lot of work, and others from her team with regards to guidance for schools. And she's been partnering with the DOE. So it's really been Department of Health and Department of Education working together to come up with some sound guidance. It is so important for our kids to be in school. And especially for the younger kids, it has more of an impact. Department of Health would like very much to help get us to a place where it's safe for kids to go to school. Dr. Campbell and her team have been doing site visits to some of the schools. And in fact, they're doing another one today. And what they've found is really good compliance at the schools. The schools have some very good mitigation measures in place, and she's been seeing good compliance at those schools. So very optimistic. It seems to be a safe thing to do, because she was noting that it's actually safer, from what she's seeing, to have the kids in school where they're being observed and where there are mitigation measures in place, as opposed to kids at home just out mingling, with others in the community. It seems to be safer to have them in school. So we're continuing to work with Department of Health. And as you know, that is a decision that will come from the Department of Education. But DOH and DOE are working together. And I think it's so important to get our kids back in school. And I'm very optimistic that we're heading that way.
Of course, one of the questions and one of the topics I should say right now is the vaccine that is coming out. We're hearing on the national level of the progress that's being made, how it could be rolled out within a week or so. We do have a question that has come in here from Wills and Cheryl, who says, do you recommend the healthcare providers get the first available vaccine for COVID-19 once it becomes available in Hawaii? And do you recommend getting more than one type of vaccine? When should we see vaccines become available in Hawaii? He also thanks you for the great work that you're doing. But if you can talk to a little bit about the plan for the vaccine rollout, who will be getting this, and sort of some of the other questions that he's addressed here.
Yeah, that's a really good question. It's actually interesting that the question includes whether we should get more than one type of vaccine. So we are expecting, there are two companies that have submitted for an emergency use authorization from the FDA. We expect that to be coming soon. And so we're expecting that we could get some vaccine for the first tier of people by the end of the month. And that vaccination is our #1 priority right now in the department. That's going to make a huge difference in the course of this pandemic. So it's all hands on deck for that, and we're working really hard on that. As noted, the first tier will be to get the frontline healthcare workers vaccinated. And the thought is that way they can continue to help care for people through the pandemic who are ill and who need care. And then we're hoping that by mid 2021, we get the entire community vaccinated, whoever wants to get vaccinated. It's a huge lift. It's #1 on our priority right now. And this is something that's not going to be handled by the Department of Health alone. This is a great example of something that we've been saying all along, where the Department of Health provides the administration, the oversight, and the guidance, but we really need the entire community to pitch in. So we're having a lot of partnerships with our healthcare sector, with our counties, with nonprofits, community groups. It's going to be an entire state effort to get this done.
I'm curious just on the logistics of all of this. We know that the vaccine, at least I believe it's the Pfizer one, and please correct me if I'm wrong on this, needs extremely cold storage. That can be done at a hospital, but when you start to think about more rural communities and even just a regular doctor's office where you would go to get a flu shot, I mean, how do you actually see this being laid out on the ground? Are we all going to go to, Queens and Kaiser to get the shots, or will this be filtered, throughout the community? What are the sort of on the ground mechanics of how this will be rolled out? And also, how do I know which tier I'm in? I'm not a healthcare worker, and this is not just for me, but for anyone. How will we be told when we are eligible?
Good questions. So the logistics, exactly as you know, are making this vaccine really, really challenging for distribution, much more so than for other vaccines that we have that can sit in a refrigerator for weeks or months at a doctor's office. So the Pfizer vaccine requires minus 70 degrees ultra cold storage. So that's a really specialized kind of freezer. The Moderna, I believe, is a minus 20 degrees. The good thing, though, is that we have mechanisms in place that you can store these vaccines. So we'll talk about the Pfizer one that requires a minus 70 degrees. It comes in shipping containers with dry ice in it. And the containers are pretty elaborate, but we can recharge it with dry ice so that we can keep that vaccine for many, many weeks, as long as we have the dry ice in those containers. We definitely have plans laid out to get the vaccine to the neighbor islands, to far reaches of the entire state, to make sure that we have accessibility for everybody. And that's the key part of the planning, because we want everybody to have access to these vaccines. In the beginning, it's probably going to go to the healthcare centers directly. And that's going to be the first lift, is that the healthcare centers will help to vaccinate their own employees. And thereafter, we will take it out to the community and make sure that we have access for everybody.
And what about the tiers? How do I know, like, if I'm an average person, I'm not a nurse, I'm not a doctor, how do I know when I'm eligible to actually get my vaccine?
We're ramping up big time with regard to the messaging, and we will get that message out so that everybody in the community knows. We're making sure that we're getting that messaging out in different languages and through different means of media. We'll get the messaging out there. Tier 1 right now has to do with healthcare workers. and people who are at highest risk. We want to make sure that our forward-facing healthcare sector, including EMS and nurses and doctors and respiratory therapists and everybody who's in the hospitals is protected. And then the next group that's been moved around is the kupuna, older than 65, and those with high-risk medical conditions. It's interesting to note that there was a priority list that came from HHS and the CDC, and then it has recently been changed. And that's why I think there was a little bit of confusion, because the priority got reevaluated by ACIP, which is a Committee on Immunization Practices. And so they reordered the list a little bit. We do have local groups here, and we have advisory committees, and there is a group looking at prioritization. So we will take those federal lists and we will make sure that it's appropriate for us locally for our needs in our community across our state. And we will get the vaccine out to everybody. Again, this is just for the initial tranches of vaccine that we receive when we don't have enough for everybody. But we absolutely plan to get everybody vaccinated who's interested across the state.
You know, as we begin this conversation about vaccines, I'm wondering if you can sort of paint a picture of what living with COVID-19 in Hawaii during next year in 2021 will look like. We're talking, you've mentioned about the rollout of these vaccines and who would get them. But amongst that, we know that it will continue to be something that will be in our community. If you can sort of paint that picture of what that looks like in terms of mask usage, testing availability, will we see more businesses open because more rapid tests will be available? If you can sort of paint the picture to what you think living with COVID in next year will look like.
I wish I had a crystal ball. We're all so anxious to get back to, doing the things that are so important to us as a culture. We want to spend time with each other. We want to be able to hug our loved ones. We're going to be wearing masks for a while. Even if and when we get everybody vaccinated, it's still going to allow, we're still going to need that second month to have that second dose of vaccine, because the vaccine is going to require 2 doses. So it's going to be quite some time that we're going to continue to wear masks. That's okay. That's doable. That's a small sacrifice for keeping ourselves safe and preventing us from ever getting the disease. The vaccines are coming out. That's going to be a game changer. It's going to be 2 shots. And so we're going to be looking at beyond summer by the time everybody's got their 2 shots. I think we're going to get kids back in school, and I think that should really be a priority for our community. As far as tests go, we are seeing the development of the technology with regards to testing advance really quickly. And that's another very, very good cause for optimism. I think at some point testing will become almost like a home pregnancy test, where people will be able to test on their own in the privacy of their own home, not require any kind of, big machines or anything. And I think the cost of the test will come down significantly. And I think once we can do that kind of widespread testing and it's just available to people, that will also allow us to be out and about a lot more and to mingle a little bit more freely. For now, stick with the distance, keep our distance, wear our masks. We're still dealing with it. We can't give up yet. The vaccines are right around the corner. We just need to hang in there a little bit more.
We have a vaccine question from Shells and Simon. And what are the side effects of the COVID-19 vaccine? I think there are a lot of people who are wary of the vaccine, and sort of piggybacking on this question, what percentage of our community needs to be vaccinated in order for this actually to work?
So you hear about herd immunity. We want to get at least 70% of our community vaccinated in order to have herd immunity. So that's the goal, is to get at least about 60 or 70% of our community vaccinated. I forgot the first half of the question.
Oh, well, what are any of the known side effects at this point?
So there have been clinical trials. I have some friends who have gotten the vaccine and not knowing, ahead of time whether they were going to get a placebo or get the actual vaccine. It sounds like, people are getting body aches and just muscle aches, and you get a sore arm. That seems to be the primary reactions that people are having to the vaccine. When I asked my friend, well, was it so bad that, if you knew that ahead of time, would you not get the vaccine? He says, no, it wasn't that big. I just, I was achy and I had a sore arm and I was tired. But I absolutely am glad that I probably got the vaccine.
We want to also just sort of bring up the issue of testing. We know that there was some debate with previous leadership in the department about how much testing should be happening. We've heard sort of the conflict that went back and forth with the mayor's office and the department in the past. What is your just overall stance on testing? Is that something that you think that we need to be doing more of? And how do you think we're doing as a community in terms of the access of testing availability to the community?
I think we're doing okay for now. Again, I mean, if we could get testing to the point where, everybody had it accessible like you would for a home pregnancy test, and you could test in the privacy of your own home every day if you wanted to, I think that would be awesome. We're not there yet. I think for now we're doing on average about 4,500 tests a day. And if you look over the past couple of days, those numbers are significantly higher. A lot of the counties have been doing surge testing. And so you see, a couple thousand more tests per day relating to that. If you look at our percent positivity rate, you like to see that number below 5. If it's significantly higher, then it means you're probably not doing enough testing and you're probably missing people. Our rate is 2.1% right now, so we're doing okay with that with regards to the amount of testing that we're doing. Certainly, it's always an issue of availability and accessibility. And we know that for some people, it's still a little bit of a challenge to get tested. So we're really focused on that as well and trying to make sure that everybody has equal access and can get tested if they need to or if it's appropriate for them to. So that continues to be something that we work on.
We're seeing a number of questions in the comments about the prison population. We saw a pretty big spike yesterday. I think over 30 cases of the total were reported from prisoners. How are we doing when it comes to protecting the prison population and keeping those numbers down? When you see a spike like that, that's pretty tough.
I think one of the challenges is that anytime you have congregate living, you have so many people in such close confines that it makes it really difficult. So any kind of sheltering situation where you have a lot of people in a small space. I believe the most recent prison outbreak also had to do with the way the housing was set up and the level of security at that facility. So it makes it really hard to isolate people and separate them individually. And so I think that kind of lends itself to having higher risk for the disease spreading amongst that population. It's a challenge. It's a big challenge to try and get people isolated and separated to the degree that we would like to in order to prevent the spread. But we're doing the best we can. We've also been working with the prisons to try and help advise on, provide some guidance for them. But it's very challenging when you have any kind of situation where you have a lot of people living together. And not just prisons. I mean, even in, some of the residential areas, it can be a real challenge.
We have another question asking about the vaccine. Dot asking, does a person who had the virus still need to get the vaccine?
So the short answer right now is yes. There's still debate going on and people who are far smarter than I am. But it seems like for now, yes, because they're not sure if you had COVID, how long will you have immunity? Just so many unanswered questions. And so I think it's still being debated. But for now, what I'm hearing is the recommendation would be yes. And that may change as we learn more and we get more information about the performance of the vaccines. It's so new, they just finished the clinical trials and we're rolling it out. So we really don't have the benefit of years of experience with how the vaccine, what the characteristics are.
We're interested also, the holidays, we're right in the middle of the holiday season. What is your advice to people? We just got through Thanksgiving. We were told not to gather. When we look at Christmas and, people going shopping and people wanting to be with each other, what is your advice to people? And I'm just curious in your own life, what are the practices that you have yourself? Do you go to restaurants? Do you shop in person? Can you tell us a little bit about your own behavior and how that might be, advice to the rest of us?
Yeah, so it's the holidays, and again, it's especially in our culture. You know, it's so important for us to be with family, and that's such a part of our culture. But don't do it. You know, we're right around the corner with vaccines. It's just not safe right now, and I think to the extent that we can each be responsible, that's going to help our whole community. Wear your masks. We know that works. Keep your distance, keep your gatherings really small, and try and limit it to your own household and not involve a whole bunch of people from other households. I'm not going out to restaurants yet. I'll do takeout. I think that's reasonable. And I'm trying to support my local restaurants, so I will do takeout. Not going shopping, and I'm absolutely not traveling right now as much as I would love to. I have a lot of brothers that would love dearly to come home and visit my parents. Now it's just not a safe time for travel overall. The CDC is recommending against it. As much as we can put those things off, I think everybody's so tired of hearing about masks and distance and whatnot, but it works. We know it works. We have data showing that it works. So if I had to leave messages, I would say, wear your mask, keep your distance. Prevention is way more effective, that you never get the disease, than on the treatment side, where we now have some drugs that can help you if you do get infections. Help each other. You know, this is especially a time, it seems kind of paradoxical, but especially now, we should pull together as a community, help each other, be kind to each other, and keep our spirit of community. If we all do our part, we can get through this. We have vaccines right around the corner.
All right, Dr. Char, we thank you so much for spending your morning with us here on this Friday and for sharing the information and an update from the Department of Health. We really appreciate it.
Thank you very much.
Aloha.
Thank you. Aloha. Wow. Well, wonderful to hear from her. She talked about so many topics this morning, and really interesting to hear her outlook for 2021. You know, even though masks and social distancing are going to be with us, she really did give me at least a lot of hope. The idea that she does think that in-person schooling will resume next fall, at least just to a much larger degree than we've seen now. And that, you know, she expects the vaccine rollout to be happening on a wide scale by the summer. You know, that feels to me, Ryan, like a light at the end of the tunnel that is very visible.
Yeah, and you know, she also mentioned the phrase game changer a few times, of course, relating to the vaccine being a game changer, of course, in the community and being able to get those out there, but also noting the rapid testing that could also become something that will help to let people know if they are in fact infected, and allowing things for maybe potentially more gatherings once those tests become more readily available, the at-home type, and that you are able to take maybe on a daily basis even. So we'll see kind of how that sort of rolls out, but also interesting to hear about the contact tracing that she spoke about, the efforts that are happening there, as well as just our overall testing capacity and how the state is doing in comparison to what's happening also on the mainland.
Yeah, things are going well. You know, when it comes to the impact of the visitors, we know that people are very wary of folks coming from the mainland. She is discouraging travel in all forms right now, but it does sound from her perspective that the Safe Travels program is helping to mitigate the spread of people who do come here. So that is also good to hear, because we know that people are pretty nervous about having those planes full of people coming from all different communities on the mainland.
Yeah, but that debate continues on, and we will talk to the governor next week on Monday about the Safe Travels program. We know that we have heard from Mayor Derek Kawakami from Kauai just on Wednesday about his thoughts and his frustrations about his plan not being approved. We'll talk to the governor about that, as well as the status of a few other programs. We also know the CARES Act funding is winding down. We'll get an update on how the state is doing spending that money before the end of the year. Also interesting to note that we did get word also from the Trump administration that they will be extending coverage for National Guard so that states can continue to use that. That I'm sure is a great news for all elected officials throughout the country who have really relied on the National Guard during this time.
Yeah, I mean, the governor and Derek Kawakami as well, Mayor Kawakami, talking about just how critical they have been on all levels of government in Hawaii. So we're very thankful the Trump administration extending their services at least through March. By then, we'll have a new administration, of course, and we'll see if that gets extended beyond then. But that does give us a nice buffer that I know a lot of people have been calling for. We have Governor Ige, as you noted, on Monday. Then we have Mayor Kirk Caldwell on Wednesday, followed by Professor Carl Bonham from UHERO on Friday. He's going to give us a look at the economic picture. And of course, we'll want to talk to Mayor Caldwell to see, can we get to Tier 3? This will probably be our last opportunity to talk to him as mayor, because we have Mayor-elect Blangiardi coming in January. But until then, Mayor Kirk Caldwell is the decision maker, and a lot of businesses and a lot of people just wondering if we are going to get to Tier 3 in the month of December.
Yeah, a lot to talk about, a lot to continue on. It is the end of the year, but still a lot of things to cover. And we certainly appreciate all of you tuning in and supporting this broadcast and continuing to engage in the conversations. We appreciate the comments and questions that come in, and we just ask that you continue to tune in Monday, Wednesday, Fridays right here on the platform. So the Honolulu Star-Advertiser for Spotlight Hawaii. We hope you have a great weekend, and we'll see you right back here with Governor Ige on Monday. Aloha.
Aloha.